Do you find yourself with a deep aching pain in your buttocks region when you go to sleep at night? It doesn't bother you during the day, but you have difficulty sleeping because of this pain, and you're wondering what's going on and what you can do about it? Well, that's what we're going to talk about today. We're going to talk about SI joint pain with sleeping, including what positions are best to sleep in, why it happens in the first place, and some other ideas you can do to get a good night's sleep. First off, SI joint pain. So the SI joint pain is located deep in the buttocks. That's why you have the pain there. It's the joint that sits in between the sacrum, which is the heart-shaped bone that's at the bottom of your spine, and the ilium. Those are the big hip bones you have on each side. So sacrum, ilium, SI joint is the joint in the middle. Some people will call it their low back. They'll be like, it's not low back, it's low back, and then they'll point to their buttocks region. Now the SI joint is really important because this is the connection in between your hips and your spine. So this is really how your feet interact with your hips, and your hips interact with your spine, which can go all the way up to your neck and shoulders. So it's a really critical joint. It doesn't really move that much, which means if you lose any movement in that SI joint, or if it starts moving too much, it can really wreak havoc quickly. So why is it that you can make it throughout the day without any problem at all, but when you lay down to sleep, you get this really bad pain deep in your buttocks? And well, most commonly, that's because the SI joint is either moving too much and building up inflammation during the day, or it's not moving correctly and building up inflammation during the day. Now, you don't notice it during the day because you're moving and the muscles are contracting and relaxing, so it's helping to move some of that inflammation out. However, when you lay down in bed at night, all that inflammation just starts to sit there, and that can get that deep, achy pain really quickly. The other thing that people tell me who have SI joint pain at night when they're in bed is that it's really difficult to get up in the morning out of bed, or they feel very stiff as soon as they get out of bed. So these are people who find themselves getting out of bed, they're bent over, they have difficulty walking to the bathroom, but as they start moving around, maybe take a shower, warm things up, things calm down, they're able to stand up straight, and then maybe able to go through all of their daily activities pain-free. So what are the common signs you'll have in bed if you have an SI joint dysfunction? Most commonly, people will complain of pain if they're laying on that side. In fact, it'll be so painful that they won't even be able to lay on that side, and if they're a side sleeper, they'll have to sleep on the other side. The other thing that people with SI joint pain tell me is that when they're trying to turn over in bed, it's very painful. So maybe they're sleeping on their side, they need to turn over onto their back because their side is getting really tired. It's really difficult for them to make that transition onto their back. Now, if your sacrum, that's the heart-shaped bone at the base of your spine, is not in proper alignment, it may actually be difficult for you to lay on your back because you may feel uneven when you're laying on your back. And the same thing can be said for my stomach sleepers. Y'all know I don't recommend sleeping on your stomach, but if you do, you may notice that there's an unevenness when you're laying on your stomach. Now, this unevenness is not necessarily due to the sacrum, but more to the ilium, or those hip bones on each side. So the first thing I am going to ask you to do, if you do have SI joint pain, that starts when you get into bed, is to work on your nighttime routine. It's really important to prepare your body appropriately to be able to get into bed and have a good night's sleep. Y'all know that I always say when you're sleeping is when you're healing, and it is so very, very true. It's important to get good quality sleep so your body and your mind can heal. I'm going to go down a little bit of a rabbit hole here just for a second, but if you haven't heard my story about the brain Roombas, there's actually these cells that come out and they live kind of covered up. They actually come out when you're in REM sleep. Those cells are the ones that help clean up the brain from the daily debris of processing all the information, and they are critically important, but they only come out during REM sleep. So you need to make sure that you're getting that good quality sleep for your mind as well as for your body. All right, back to our regularly scheduled programming now. So how do you develop a good nighttime routine? Well, research clearly shows that we need to stay away from screens for 60 minutes before we go to bed. Now, what are you going to do with all that time? Well, obviously you have your normal things. Maybe you wash your face, maybe you take a shower, maybe you brush your teeth and floss. Those are good, healthy things for you to do. I'm going to encourage you to add in some very gentle things that are also good for your body. It could be some gentle stretching. Maybe you want to do some breathing exercises. Or maybe you want a chance to just lay down and relax your whole entire body. Whatever works for you to help prepare your body for sleep. Now, additionally, we want to prepare our mind appropriately for sleep. This could be things such as reading an encouraging book, gratitude journaling, or even writing down your worries for the day. There's research that indicates writing down your worries before you go to bed makes them look much smaller when you get up in the morning. Again, choose the process that works for you, but make sure you have something to work on your mind and your body before you get into bed. You want to make sure also that your bedroom is a comfortable place for you to sleep, and that the only thing you do in your bedroom is sleep. You want it to be clean, you want it to be dark, you want it to be comfortable. I recommend not having your cell phone as your alarm clock, but getting a regular alarm clock and putting the cell phone in another room. And if you currently have your home office in your bedroom, find a way to move it to another room so that room can be reserved specifically for sleeping. Another thing you're going to need to do is avoid alcohol and caffeine. Now, you don't have to give up caffeine altogether, but you do want to stop drinking it at a certain time every day. For me, my time is noon. I cannot drink caffeine after noon or I will be up all night. Your time may be different and that's fine, but make sure you know what time to stop drinking caffeine to get a good night's sleep. Now, many people think that drinking alcohol will actually help improve the quality of your sleep. I am here to tell you there is so much research out there that proves exactly the opposite. You do not want to be drinking alcohol if you're trying to improve your sleep. I understand you may feel like it helps with your SI joint pain or you don't notice your pain as much, but it is affecting your sleep pattern, and when you're sleeping is when you're healing. All right, so if you have SI joint pain, what position should you be sleeping in? I recommend sleeping on your side, obviously making sure it's the pain-free side. Now, when you're doing this, you want to have a pillow or maybe two in between your knees because, ladies, our knees go in much further than our hips. So you want to make sure you have good support so that your knees are in line with your hips. And support is so important. I want to make sure that you have a good pillow that's not only filling in this hole here, but is filling in this hole here. Because we don't want to start having neck pain because we're treating our SI joint dysfunction. Now, if you find that you tend to rotate your spine a lot when you're sleeping on your side, I'm going to recommend that you put a pillow in front of you and you just kind of gently hug it with that top arm. This will help to keep your spine stacked on top of your pelvis and your hips also in line with your pelvis. Now, if you're like, there's absolutely no way I can sleep on my side, then the next best position would be sleeping on your back. You want to make sure that you have a pillow underneath your knees, and this is to help release the hamstring tension. This is super important if you have SI joint issues because the hamstrings attach onto the ilium. Remember those big hip bones on each side? The hamstrings attach directly on them. So we want to make sure that we're not causing stress through the hamstrings, which could further the SI joint dysfunction. Now, if you're laying on your back, again, you want to make sure that your neck is accurately supported. For some people, that's no pillow at all. For some people, they'll take a hand towel and they'll roll it up and put it underneath their neck, and that helps to give the crook of their neck some support without too much pressure on their head. Now, I will say, I had one patient who had SI joint dysfunction who also had a very big kyphosis, so was very bent forward. In his case, what we had to do was actually have him sleep on two pillows. One was kind of jammed under his neck, and then one was more underneath his shoulders to make sure that his neck was accurately supported. So as you can see, it's important to find the pillow and towel support that works for your body. Our goal is that your spine would be in a neutral position while you're sleeping, or as neutral as it can be for you. So if you're sleeping on your stomach, you're causing increased stress not only through your SI joint, but definitely through your neck and shoulders as you have to turn your head to the side for prolonged periods of time. This is definitely going to cause some neck and shoulder problems later on in life. So I definitely encourage you to find either side sleeping position or laying on your back position and change it now before you cause any permanent damage. All right, over to you. What has helped you to be able to sleep better with your SI joint dysfunction? And if you're wondering if what you have is an SI joint dysfunction or a low back pain, then I'm going to recommend you check out this video over here where we discuss the difference between the two. If you like this video, give me a thumbs up, and I'd love for you to click subscribe. Have a great day, everyone.